guys, welcome back to another episode of V.I.Ps in Action, Village Innovative Perinatal Support in Action. I am your host, Dr. Joanne Michelle Martin, JMM Health Solutions in the Atlanta metro area. And we are interviewing amazing birth professionals throughout this series on YouTube who have been supporting individuals, moms within the community, throughout this whole COVID-19 pandemic, which has really been tough and really been a struggle for so many, especially those within the birthing community and those moms. I mean, moms have had to, be in the hospitals, be alone, have, limited access to resources because we can't do a lot in person. And so it's been really interesting to see how other birth professionals have been able to pivot during this time. And today's episode is going to be a great one, guys. You're going to love this. We are going to be chatting with Dr. Wale and Tia Ajao. She's an RN, and they are in the Baltimore metro area. They are the owners of Hello Baby Event. Welcome, guys.
Thank
Hello.
you.
You're welcome. You're welcome. So thank you for joining us today. Tell us a little bit about yourself. I love for people to take the floor. So tell us a little bit about yourself. I know you guys are in the Baltimore metro, but and on your respective fields. Dr. Wale, you're a doctor for sure, but I'm thinking, I don't know what subspecialty that is there. And Miss Tia, you're an RN. So tell us a little bit more about yourselves, your backgrounds, and how you serve mamas in the Baltimore metro area.
All right, since you asked about my doctorhood, I went to med school in Nigeria. So graduated from med school there, but my desire was to spend less time in the clinics and spend more time, out there, in a sense, making a difference in public health, either through medical illustration or education or informatics. And so I've spent most of that time outside the clinics. So even here in the US, I decided not to practice clinical medicine. So I've been doing, I went back for a master's in communication, which I hope to use in health communications. And then during that period, my wife would mention the word doula. I'm like, what's a doula? And she'd be like, something, birth helper, something. So one in, one ear out the other, you know. And then every once in a while I'll hear more about it, but it never really sunk in. Even during um, pregnancy and delivery of our two children, um, I wasn't able to give her the support that I know now that she could have really benefited from. I was just like, no, whatever the doctor says. Oh, okay. Oh, the baby is the heart rate is what's it called? Yeah, CS. Okay, get baby out. Oh, you had a CS, so you have to have a CS next time. We don't try scars where we come from. It's just not done. Um, you know, um, Giving her the emotional support. I was there. I was sympathetic, but I believe I could have been trained better. To be more mindful about what she was going through and being more proactive about how to support her. So eventually I got involved with her outreaches to at-risk pregnant, I think
Teenagers
like
at the
teenage,
time.
some of them teenagers. So at that time I was helping with community baby showers, providing the creative games. All right. Sorry, let me close that door.
And just to give a little background with that, the creative games were things that we actually developed together to make educational material like easy to be digested, like with the community that we were serving. So he took the lead on the creative side of creating the games and also in using audiovisual skills to really make it shine.
And then so we eventually graduated from that to actually officially doing baby showers. And at the baby showers, we were teaching. So instead of typical baby shower games, like you bring out a tissue, you try to guess the size of the belly and all that stuff, we replaced all that with more educational games. And then one day it hit us was, wow, look, this baby shower is the last time the mother's going to see all these people, her friends, her family, her neighbors, her work colleagues, under the same roof before the baby is born. So it's a wasted opportunity if we can't use this as an opportunity to support, or as an opportunity to advocate and get the community to support the mother. That's where we get to tell all those people, oh, you know what, you guys don't rush after the baby is born. Don't all rush in at once to see the baby and then disappear for the rest of the baby's life. Stagger your visits, plan your contributions. Here's a schedule. Kind of like instead of a gift registry, let it be a time registry. Let it be something. So yeah. In the process, that was where I was finally big. She was finally able to convince me to become an educator, like a Lamaze certified educator. So I went for that training, and that was where my eyes actually opened to the fact that pregnancy is a natural process. Our medical training, we're taught to see pregnancy as a a disease. A disease, something that the mother might not recover from. And that's true. It's true that yes, some people go to get pregnant, so some go to deliver and they die in the process. So that's a reality. It's a medical reality. But I don't believe it was good for us to be trained with the mindset of putting out fires, like seeing every pregnancy as a fire. So that was my first introduction to the fact that we can treat pregnancy as a natural thing, and we can support pregnant women, or birthing people emotionally, and that emotional support actually goes a long way.
And I love that. I love that, especially because one, you're a physician, and it's a completely different mindset. Like you mentioned, it's a completely different mindset, And I tell people all the time, doctors don't go to the hospital with the intent, like, yeah, I'm going to do something to mess this family up. Like, that is my job today. I'm going to jack this family up. Like, that's not their intent. But, for whatever reason, things can go awry with birth and with delivery. But the way that women are supported by birth professionals, by the midwifery model, through doula support, through other perinatal specialists, is a lot different than what's seen by the medical model. And then when we factor in cultural, because like you mentioned, it's seen as a disease. I remember growing up in Barbados, my grandmother used to say, when you're pregnant, you got one foot in the grave and one foot out.
Wow.
And I was like, wait, what? Like, don't say that. Nobody would ever have children. But that's the way they saw it. And it was, in the society, they were very much, or at least by the time I was old enough to kind of understand a lot of these things, it was very much, well, the doctor said do this, you're doing this. You don't go away from what the doctor said. The doctor is the boss, and that's it. Right. So we've gotten away from a lot of the community type things, a lot of the grannies and the aunties coming in and doing a lot of that village type, work with families, which is where I really think that we need to get back to.
Yes, thank you for that.
Yeah. So that was my first introduction to pregnancy as a natural process, and that the pain of pregnancy was not suffering, but it was pain that is bearable. It sometimes feels unbearable, but it's not. It's pain with a purpose. It's trying to get the body to do something. So all the years of stigmatizing that pain haven't necessarily done the pregnant people good. So the next step was we went together for doula training. So that was my real come to Jesus moment. That was when I was like, like it was like the whole world, it was like a conspiracy all this while. Like doulas, I mean, you guys have documented evidence, like objective documented evidence that doulas reduce maternal mortality, and nobody knows about doulas. Like, what's going on here? As I've been doctor, and I've never heard the word doula before. I know doctors, literal doctors I thought maybe it was because they didn't practice here in the US. I know doctors who practice here in the US for up to 40 years who had never heard the word doula. I was like, what's going on here? So I got to understand the I'm able to look at the issue from both sides, because all the doctors I have ever known, all people I've practiced with, they've all been decent people. I've not known a single doctor who wakes up in the morning with glee, like sharpening knives. I'm ready to
Right.
slice people open. I've never seen that kind of doctor before. So I'm able to humanize the hospital system and humanize the doctors. Then I was able to see that okay, there's a language barrier, because the doctor is in a set, especially here in the US, is in a system where the hospital isn't ready to take any risk. They don't want litigation and they don't want mortality. So they have some procedures that have been put in place to reduce mortality. It's a take no chances approach. On the flip side, you have a patient who is in pain, who is uncomfortable, who gets into emotional states that they normally wouldn't be if they weren't pregnant. So emotional states and the pain make them look as if they are they look as if they're about to die. They look like they look like an emergency. So the doctor speaks and the patient is hearing hospitalese. That's the language they're hearing. They're hearing doctorese. And the patient is speaking and the doctor is hearing, I'm about to die, ease. So it's two completely different languages.
Yeah.
And there's a miscommunication. So doulas, I believe, help to translate to the doctor, translate to the patient, translate to the doctor, temper expectations, help the patient feel heard, and all that kind of stuff.
How much of that, though, you feel is because one party is not listening or both parties? Because oftentimes, there was a research study that came out in 2018 that said when people go to a physician, it is usually they're interrupted within 11 seconds.
Wow.
And I know that there was some evidence in there that suggested that there were times when it was shorter. Within 5 seconds, they were interrupted, and they're not typically in the doctor's office for any substantial length of time. And we can blame a lot of things for that, the insurance model and so on, practice models, and capitalism, whatever have you. But we don't have time to establish relationships in during the perinatal period, and then we come to the delivery and we have that same construct, and there's no listening, because it's like, all right, we got to get this baby out, we got things to do. You're doing what? Okay, no, we're not doing that, we're doing this. We can talk about things like positioning. You're a doula. I'm also a birth doula, and I love the doula world. I think more people need to be aware of it. And you are right, there are physicians that have been practicing for decades and have no idea what a doula is, or the purpose, or the benefit, and things like positioning. When these women are having immense back pain, but they're in, that supine position, that dorsal lithotomy position, legs up in the air, putting their hips at potential risk of injury, because then they come out and they're like, I can't walk, and I got back pain, and I got this pain over here, and and all that could be simply from positioning. And we could have simply turned them on their side, put them on their hands and knees, done something to help with the pain, but also help make that birthing process a little bit easier. What do you guys find in your own doula practice? So are you guys currently practicing as doulas and servicing patients within the hospital systems there?
So I come in a little bit more on that end. I actually became a doula about 6 years ago when I saw a nursing school program in Baltimore that had a doula program embedded in it. And so I went to nursing school to become a doula. And I did so at Johns Hopkins University School of Nursing through the Birth Companions Doula program. And that was what it kind of drew me into the profession that way. Um, and the program was kind of a volunteer program. So we were at that time providing services for free to the client, but the program had grant funding to make it possible to pay us per hour for the time that we dedicated to our work. So it was a wonderful way to transition into the nursing field in 2015 as both a nurse and a doula because of the experience I had gained. I actually landed my first job for my last doula client while in that program. And so it kind of was a wonderful way to transition into the hospital setting. I will say, becoming a nurse was slightly challenging in that you have to learn the ropes and you kind of start to be trained the same way we've been talking about in that medical model. Because I mean, the way I describe it is nurses are like the minions of the hospital. And we have to follow orders that are put in place by clinicians. I started in the mother baby field and pretty much kind of grew up into mother baby. So now I'm also a postpartum doula as well. And I think that's where I shine the most, the postpartum setting. But when it came to birth doula work, became very, very clear that it's extremely hard to be at the bedside as a nurse who is also trying to doula the client of the hospital.
Mm-hmm.
If that makes sense. Like it's better to be a doula with all of the expansive knowledge and understanding. I come from public health, you know, even with Wiley as a medical doctor, you come in, you look like the little doula in the corner, but you had the backing of so much education and so much awareness and so much empowerment for that client. It's a more strategic way to go around. But I was becoming extremely frustrated at the bedside, extremely, as a nurse trying to doula my patients, in that medical setting. Because again, I had to take orders. Then once I'm given those orders, because most of the time it's the nurse coming in, okay, we gotta up the pit, and okay, your clinician says they want you on your back. And it's Tia the doula telling you that, so it wasn't really measuring up. And so I've decided to graduate from that environment. I'm now a student of nurse midwifery at the time. But what our thought process is as a business is to be doula, what we call doula advocates. And that's one of the amazing things that we've been empowered to do through this particular grant that we've received. When we say we're doula advocates, we take all of our professional know-how, we take all of our knowledge and all of our heart and all of our advocacy, and then we look at the doula themselves and we realize the doula needs to be doulaed. And there's so much, especially in our area in the DMV, we have a slew of people. It's almost like a factory now. We're rolling over new birth workers almost by the daily. And you have very excited people who start off in the field of doula work and whose fire just burns out.
Yeah, I think the stat that I heard some time back was the typical length of time, the burnout rate is probably about 2 years.
Wow.
Yeah, for doulas. They don't last. I mean, so there are a lot of people who come into it, very gun ho, but may not have a great sense of what they're coming into, a great sense of the environment, a great sense of the emotional tug, because it's one thing to support moms, but it's another thing to detach your own emotions in a way that you still stay empathetic and supportive, but you are not taking on everything that's happening, because it can be very, very tough. And for a lot of doulas, they struggle with that.
Yeah. I think doulas are the only, in my opinion, the only profession where a lot of the emotional energy is required to do the job well. So it's both personal and business at the same time. And I believe that toll is not something to be sneezed at. I don't know many doulas who do that, who see so many patients every month and week in, week out. Who I don't believe it's something that they should be doing like without support, without a network, backing them up so that they can recharge after each outing.
And I agree with that. And you may see this in your practice as well. There's something about this work. It's almost like they come in threes or fours, and those clients that they planned for the month, they all start to come back to back to back, and you see a lot of birth workers. I mean, enjoying that and celebrating that, but they are worn out after that. And it seems to just happen. It even happened to me recently, where I had a home birth on one day, and next day I'm running out to Virginia for, another birth back to back. It was almost like I put my head down, and then goes ring, ring. Tia, we need you out to Tia, So, and we see that at least for those who are active in the field. And there's a whole nother group of folks who are just struggling to get a birth. And it's not that they are not capable. The whole dynamic of making those connections and really knowing how to to charge your worth and really understand how to balance it out, your heart as opposed as also connected with your own needs. There are so many birth workers out here who can't pay their own bills, but they run enough to support a client holistically and with everything they got on the inside of them, but they can't pay their own bills. So in our mind, and a lot of our colleagues have said the same thing. Hey, you guys have an entity, we're a nonprofit, to go ahead and figure out ways to support our birth worker community, and it's a huge community.
Yeah, there are a lot of doulas in Maryland, in that DMV area, a lot.
So we're trying to connect them with created groups, special interest groups where we interact with them. My focus has been less supporting the birthing people as much as the actual doula advocacy. I feel the fact that people don't know what doulas are is a big handicap. So in my spare time, whenever I have the time, I try to focus on improving the awareness of what doulas are. I feel like if we can get the message across to the mainstream, because right now the mainstream impression of doulas is people on the mountaintop with bangles and tambourines, incense and all that stuff. So that's the impression the mainstream has about doulas. Some hippie granola thing that is not for everybody.
Either that or that they're the rebels of the birth world, and they're
exactly
doctor, and it's like
exactly. So that's the other side of my messaging. The other side of my messaging is to temper the, like, you might see in some doula circles where the hospital has been demonized. I feel I can help with tempering the message so that we see the human side of the hospital. Today I saw a video of a guy in the UK. He's like severe COVID-19. He couldn't breathe without oxygen, and they were like, his relatives had stormed the place, and I don't know if they stormed the place, but his relatives were in the intensive care unit, demanding that they let him go home. And the guy himself was like, I want to go home. And they were like, if we let you go home, you're going to die. You have 30 minutes left to live. And they were like, no, we don't believe this corona thing. We want to go home. So as far as they were concerned, the hospital was trying to keep their person hostage, elderly man, trying to keep him hostage. And so they were really disruptive as far as the hospital was concerned. So the hospital is looking at them as this ignorant people who are just coming to disrupt our way of life, and it's very possible for a hospital to look at a doula that way. So a doula needs to be sensitive to how they're coming across. I'm not saying that doula is wrong to challenge the hospital, but I believe there are ways for us to do it such that we are not seeing, so what the way to do is that they're not letting their guard up against us, before any word is uttered, so those nuances, and it's very delicate. We have to work that out. But more importantly, I just want everybody to know what a doula is.
I wanted to interject on that a little bit because recently I had a doula client that I supported. I was able to support them at the bedside, even regardless of COVID. And I decided to put my nurse hat down, like 100%, and just be 100% a doula for this mom. And if I could express to you what it felt like being treated like the other, being treated like this person in this room, I didn't make, and I hardly even said a word. I stayed in my place. I kept my position very low in the room. I would sit on a stool, that type of thing. I kept my, and I didn't verbalize very much. I made a very serene environment for my client. I allowed them to rest. I kind of try to be out of the way as much as possible, but still yet, I felt all of it, of what our doula community has been saying all along, and it was a point in time where I was escorted off the unit.
Wow.
When I was escorted off the unit, told that no, I'm not supposed to be in that environment, and talk to your client later. And I'll never forget the way I felt that moment. I thought to myself, this client has paid for my service, and now I'm being walked off and out of this hospital. I have an obligation to this client. And so it just all kind of really became real. It became real about what we've been struggling with, especially in this COVID environment.
I think it's very important to highlight that though, because for one, you don't work for the hospital, you work for the clients. And at the end of the day, the client and their needs should be priority. I think that there truly is an environment in some places and some facilities more so than others based on, the dialogues in certain doula circles, that there may be some hospitals that are more amenable to doulas versus others where there seems to be a strong pushback. And when I talk to people in general, any type of birth professional, but especially doulas, I always try to emphasize when you start out in this field, you need to make sure that you are forging relationships, because at the end of the day, it's about relationships. I remember going into a birth whereby, when I got there, the nurse was completely ignoring my patient. My patient had asked if she could get an epidural. I mean, like she got to the hospital and within 2 hours the baby was out. And when I told her to go to the hospital, her contractions were like every 7 minutes apart. Half an hour later, they were every four.
Mm-hmm.
And I'd only told her to go because I was like, all right, it's gonna take me half an hour to get to you. I said, you can go ahead and go, especially because they're more painful and they seem more intense. So let's just go ahead. You're not too far away. You're not going to be able to drive yourself anyway. Let's just go ahead and go. And I remember that nurse was, she wasn't answering any questions. And I said, my client had asked a question. I said, is it possible to kind of give her some type of feedback as to, or your opinions as to whether she would be able? And I mean, I knew she wasn't going to be able to get the epidural, but again, she's asking the nurse. The nurse should have said something, and the nurse was like, "Well, she'll have to ask the doctor when the doctor comes," and it was very dismissive. And so we went into the room. I'm like, sweetie, you are doing phenomenal. I got in there. I started to support her. Luckily, when the doctor came in, and I introduced myself and I said, well, I'm just going to get out of the way, but I wanted to ask if when you're finished checking her, it would be possible for us to change positions. She had some back pain during her pregnancy, and I was seeing her as a pelvic floor therapist during her pregnancy. But because of her contractions now, it's aggravating that back pain. So could we just, change position if that's okay with you? And she was like, yeah, absolutely. But it wasn't well, you need to do this, and this. It was just very much a, hey, here's what's going on. I've been working with her prenatally just to kind of give you a heads up. If it's okay, let's try to see if we can do this. And so she was very amenable, but by the same token, I've had other doulas that have remarked, that like in your situation, they were dismissed, they were pushed aside. And most of the time they aren't speaking to the physician directly. Like they'll ask the mom, hey mom, is you remember we talked about your birth plan, is this something that you want, do you want to change that, just to kind of give the mom or the partner the option to kind of speak up if need be. But I think you guys have made very, very great points in terms of we really need to keep the conversations going. We definitely need to create more awareness, because again, at the end of the day, when we're talking about maternal mortality, morbidity rates, if the presence of a single person being a doula could decrease cesarean births by 40%, could decrease maternal mortality risk, and decrease a lot of these other things, then why not do it? It's almost a no-brainer. It's an absolute no-brainer. Why not do that? If this is something that just has so many benefits, why not? So I think we really need to keep the conversation going in that regard, to kind of make sure that more doctors are on board, more moms know. Nowadays moms are going, it's more of a direct to consumer model. They're not going to the doctor and asking for referrals anymore. They're coming straight to the doulas. I want you. So helping more families to become aware. Did you know that this was an option? Let me tell you a little bit more about this. So I love what you guys are doing, to kind of spread that awareness. With regards to COVID though, how have you guys found it to be, just disseminating information, working with families, working with other doulas? How has it been over the last several months?
I would say that, of course, we've all had to pivot in very monumental ways. I was an educator at a facility where they literally almost shut down, 100% shut down my department for my education, community health education. At the same time, serving at a birth center, which literally has been the go-to for at least 27 years in the greater Baltimore DMV area, literally shut their doors 100% during the COVID pandemic. And that was a job for me that was very enriching and um, very solution based to me, because I began to see they took Medicaid, and I got my bottle of mommies were running up 45 minutes, and they were running up there toward this birth center. And I was seeing these babies coming through all of these maternal health challenges that we're focused on right now. I didn't see one bit of it.
Mhm.
I didn't see one bit of it. But of course, in a hospital setting, they brainwash them, and they say a lot of bad things about out of hospital birth with no premise and no evidence behind what they say. And I'm saying they, as in nurses like myself, because I don't think I would have even had a fuller understanding of out of hospital birth without that experience, of serving there. And so as COVID began, and we were still in operation, people started to swarm in that direction, seeking a birth and birth instead of being in a hospital setting. So that was extremely significant. But of course, not everybody can have an out of hospital birth for their own health and safety. So you began to see a leverage, and especially with the midwives I was working with, in guiding families to make decisions not out of fear, but out of their own informed understanding of their own birth choices. So it's very liberating to see all of that, and very unfortunate to see the facility close during COVID. That was, I want to say, probably the most significant experience, because we even had a collaboration there where we were teaching our Lamaze classes at that facility, which it made so much sense, because naturally birthing people, they need to get their pain medication from their doula. They need to use all of it during birth. And so teaching in that setting was really like a great opportunity to us. So again, it was a humongous loss when they did decide to close all the way. But I will say that a lot of the relationships we built in that experience as business owners allowed us to kind of take that into the virtual setting. Found ourselves doing childbirth education for doulas, for new doulas who are learning the physiologic process of birth. We were doing classes for doulas. We began to do classes for more clients as well, but actually the doulas were becoming our client in a way.
Yeah. And and that's what we kind of are doing with the grant. We understand that there are a lot of doulas out there who really want to help, who want to donate their time and their energy. So what we did was we first of all created a group and to try and meet more doulas and get to understand the doulas that have that mindset, who have quality products. Like on a good day, they would charge maybe over $1,000, $1,500 for their whole service. So we're like, okay, what about the I think it was the prenatal.
Mhm.
What if we took the prenatal part of your service? Like, how much would you charge for that? Some of them were like 700, 500, 300. You know. So we were like, if we could get doulas who are ready to subsidize that part of the service for as little as 300, then we could use 200 out of the grant to offset that. So a doula that charges 500, if they're charging 300 for that service, that means that doula has contributed 200 to, like, doula is donating 200 to that service, and then we, via the grant, donate another 200. So the patient essentially only pays $100 for that service. So that was the mindset. But somehow, I don't think we were able to get.
Well, actually, to kind of pivot on that a little bit, we were actually, again, we started to make these relationships with doulas in the community. And there was a cohort, a collective of doulas who we did some training for earlier in COVID. It's a collective of all Black women. They are all skilled beyond being a doula. Some are nurses, some are medical school students, some are and was an MPH person there, some are techs, OB techs and things like that. So, we just kind of offered that to them as a service because they were a new collective coming kind of a little bit, they trained a little bit before COVID. And they came through, we did the training and we thought that was it. Well, we actually did have a challenge getting doulas to support the project after a while, until one of the young ladies in that collective, they actually heard about the project that Rose is doing, and they reached out to us. We heard you guys are involved with this project, and you will not believe they have been able to get all of the doula clients, and they've all donated that time as well as described, so that they can be a part of this as our official partner. They call themselves the Safe Sisters, and they're in the whole Baltimore DMV area. I mean, they almost came out for heaven. I don't even know where they came from. They just literally came to fill a need. And what's so exciting about that is that we've been doing advocacy sessions for dyads, for doula client dyads. And they've been coming in for advocacy training as a team, as a doula and the client. Both of them are getting the training. And when they leave from there, they continue the conversation.
So that advocacy training is actually our addition to the service. So apart from getting the doula service at a discounted rate, you also get to attend a Zoom session where we're basically teaching the birthing person how to advocate for themselves, right? Like, if you were by yourself and there was no doula, like how would you talk? How would you raise the issues in a way that you're not dismissed or seen as antagonistic? So the doulas being there with them is just like it's just really,
it's just perfect.
yeah.
That's awesome. I love that. And I was just gonna ask you too, how else are you guys being able to kind of, utilize this virtual format now? There's so much that we can't do that we used to do before. Not that we so much can't do it, but it takes us on a different path, or it's taken us on a different path. And now to be able to offer some of these services that people once thought, well, we can only do this in person. Childbirth education, you have to be there in person. Now it's like, well, it's great. They're at home. They're in the comfort of their own home. They can move around the way they like. Yes, let's practice comfort measures. Yes, move the furniture, Dad. Let's give mom some room, and so now we can do all these things because at the end of the day, when they're laboring, right, they're gonna be at home. They're already in their environment. They're kind of already prepared for it. It's like perfect. And these are kind of things that we didn't think about prior to COVID, but it goes so well together, and I love that, and I love what you guys are doing with regards to advocacy, because I don't know that a lot of people get into doula work necessarily thinking of themselves as advocates and birth justice individuals and stuff like that. They're like, I want to help moms. Most of them just say, I want to help moms. And then somewhere along the line, it's like, no, I got to advocate for these people. No, I've got to advocate for birth. I've got to advocate for, and then you realize the gravity. It's so much more than just this one patient. It's like, oh my God, all these other things are happening that we really need to address.
Mhm.
So what based on all the stuff you're doing now, how do you guys see your work progressing in the next several months, beyond COVID, once things start to clear? How do you guys see, your business, Hello Baby, progressing and offering services and helping to educate these doulas and these birthing families?
Well, from my end, um, what I hope to do is improve the messaging, improve the visibility of the website, leverage the classes such that we're reaching more people. So all the different classes we're doing, maybe have some of them standardized so that people can watch them more frequently and things like that. And then later on, I think we're eventually hoping to move into potentially midwifery, which is like improving the number, like the way we're trying to increase the number of doulas. We also want to improve the branding around other natural childbirth channels. So like again, when I don't believe the hospitals are bad, but I believe that the alternative methods, we need to look at the standardized versions of those things work very well. Like the center she was talking about, very, very, very low mortality rate. Very low mortality rate. When you go there, it looks like a home. It's set up. It looks like you're in someone's home. Nothing beeping around. And and yes, they were close to a hospital, close to emergency centers, which I always recommend. I'm like, always have a backup.
Mm-hmm.
But it was always, I mean, it's almost too good to be true when you think about it.
Yeah, I agree with what Wally said, and I think that experience did kind of cause a little bit of a pivot for us, because it was like the place shut down, and it was just like, but the spirit didn't shut down. So it's almost like everybody went out in their own direction to continue that kind of work.
Yeah.
You know what I'm saying?
Yeah.
Very powerful things. And what's most exciting about it, the place was called Special Beginnings. The person who owned it was a registered nurse. She didn't have any other letters behind her name. So that was empowering for me to realize and recognize that there's really no limit for us. We have to recognize that when we find our place, when we find the environment in which we belong, then we need to grow and flourish and become so much more, not for us only, but for the community that's looking up towards us to make that change. So I started my midwifery program, and I'm actually at George Washington University School of Nursing. I got my public health degree almost a little more over a dozen years ago from the same place. And so I'm an alma mater. I'm back. It's a short program, just about 2 or 3 years. But the thought process is we're already in that prevention primary care side of things. We're thinking about that prenatal care. We're thinking about, all right, mama, you've just found out you're pregnant. All right, let's get you educated. Let's get you deciding what facility, where do you want your birthday to be at, right? Where do you want your birthday to take place. Let's find your venue. All right, who do you want to be your officiant? Let's go ahead and get you connected to the person that's like-minded with you, who can actually care for you based on your specific needs. Okay, now let's get you in the childbirth ed. All right, here's a doula. Pick your doula right now and walk through your birth journey. We call it a birth story. From the beginning, intentionally, with a prevention, proactive perspective, and Black women doing this with their families. Because I've seen other folks do this seamlessly, and I'm just asking myself, how do I get to my mamas early enough? It's sometimes very hard getting my mamas in class. And I used to do tours in the hospital I worked at, and I'll have a mama every so often say, wait a minute, where are your tubs? Where are the water births? I was told y'all do water births. And she's 39 weeks or something. Girl, then she break down crying, talking about, they told me we did a water birth. I said, girl, no hospital with this whole town do water birth, girl. So stop that. We should have got you early.
I feel like people feel sometimes that they don't need it though. I feel like the consensus is, oh, I don't need that. I just go to the hospital. I don't need education. What? I don't need that. But they get surprised. And I remember prior to COVID, I was working with a hospital, and I was a part of their childbirth education class that they offered once a month, and I would lecture on pelvic health. So prenatal pelvic health, conditions that they, should be concerned about, when to seek help, and then postpartum pelvic health. And it was so interesting to me because I remember one lady reaching out, and she was like, I'm about to have this baby in 2 weeks, and you're the first person I've ever heard talk about this. And that was one of the reasons why I was like, let me work with the hospital to offer this education. It was free. It's free to them. It's a community service. But get that information out there. I had several of them reach out to me afterwards for care, because then they ended up saying, well, I had the baby, but the doctor never mentioned any of these things, and if not for that session I had with you, I would not have known what to do, because everybody's telling me, oh, that's just normal. And so, whether it's leaking or pain, persistent pain, and all these different things. And so then I would see them afterwards, and it's like, yeah, but that's the reason we need to educate people, because oftentimes you don't know what you don't know. Yeah. And then for other people, it's a sense of, well, that's not going to be me. I don't need that. I don't need that, And so I think we really need to continue educating, continue reaching the masses, because you might reach somebody, and then they might be like, oh, let me go tell my friend about this thing that I heard. And then they go tell somebody else. And then we kind of get that trickle down effect of getting that information out there. So I would say kudos to you both. I love it. I'm looking forward to Hello Baby Birthing Center coming soon. Coming soon to the Baltimore metro area. I've got family in Baltimore, so I'm looking that when I come, I could come visit the Hello Baby Birthing Center. I'm just going to put that out there.
Music to my ears.
Let's manifest that right now. Yeah, because there are a lot of people. There are a lot of births that happen in the DMV.
Yes. Lot. Yes, I mean, even with, it's nice to see some of the parent midwives, who are also actually nurse midwives, getting into home births in our local area. So we definitely, I mean, I personally jump in and support. He's my backup to contact if they need me for a birth, for example. So I'm just hoping in the next, hopefully not too much more than a year, where we begin to see some major things happening. With the Momnibus Act of 2020, for example, which is a slew of about, I want to say it's 9 different bills surrounded around maternal health, specifically Black maternal health, that talks about all of the social determinants of health at the same time. And so it's a very aggressive bill that is currently still on the table. And just kind of hopefully in a very hopeful environment right now, and hoping that more action happens, especially on the policies, because once those things move forward, then the funding can move in, the support for that nationally can move in, and I'm hoping that all of us doulas will be in a strategic place at that time, to make more of a difference.
Absolutely, absolutely. Well, I thank you guys so much. It was an absolute pleasure chatting with you. I'm still manifesting this Hello Baby midwifery. Birthing center. Look, listen, the director right there, and you are the two directors, and y'all running this show, and you might.
The main director.
Well, because you're in midwifery school, so you may want to get in on the action. I don't know. You may want to like let go of the admin stuff and let Wale do the admin and just kind of get in there hands on with the birth. But I see it. I see it right now.
Yeah, and my dream is also to be able to walk into the hospital and say, hey, we're here, we want to talk to you about doulas, and have all the doctors and nurses and everybody actually sit down with us and hear us sell the concept of doulas in ways that they probably haven't heard it.
Oh, that would be such a blessing.
Formula people be showing up in the
right?
Exactly.
Right.
We have a conference about
just come, open my food. I want to tell you about doulas.
Listen, I'm telling you, but listen, we need that kind of, we need something like that. And we got to speak these things into existence. They're going to happen, right? The change has to start somehow. It has to start some way, right? And we can either sit down and we can dream about it, or we can be like, you know what? Let me just go do this. Let's see what happens. And I love what you guys are doing, because you guys are action takers. You guys aren't passive and sitting on the sidelines like, all right, well, COVID happened, let's like kind of wrap it up. Like, you guys are like, no, how do we pivot? How do we continue to serve? And I absolutely love that. And I think that is so necessary. And for those of you guys listening, if you are in the DMV area, if you are a doula, if you need support, if you are looking for mentorship, guidance, look no further. Hello Baby in Baltimore. And if you are a birthing family in need of support, these are the people that you need to go to. So I absolutely thank you guys. I love what you're doing. I look forward to hearing even more about all this amazing stuff. So when this birthing center opening again?
We'll time it out. We have to make a timeline now.
You'll be the first to hear.
I'm excited. Get the ribbon cutting ceremony.
Yes, ma'am.
Okay. I'm holding y'all to that. Well, guys, thank you for joining us again for another episode of V.I.Ps in Action, Village Innovating Perinatal Support. Guys, this grant funded by R.O.S.E has been to all these amazing birth professionals, has been such a blessing. And listening to this episode and the ones before, you can tell how much of a difference it is making in communities, supporting other birth workers, supporting birthing individuals, moms and the like, and just really making a huge impact. So if you are in Baltimore, if you're in the DMV area again, and you are a doula, you're a birthing family, you're in need of support, reach out to Hello Baby. What is the best way for people to get in touch with you?
Instagram has been very strategic. A lot of posts have reached out via Instagram. So it's simply at Hello Baby Events on Instagram. Yep. And then we can inbox us and we'll talk.
So go to Instagram at Hello Baby Events, find them there, send them a DM, slide into those DMs, guys. And just learn from the people who are doing amazing stuff. So until next time, guys, we will see you back here again for V.I.Ps in Action. Take care.
Awesome. Thank you.
Bye, everyone.